into like an oppressed caste in India with where we didn't have an access, which drive me to become initially come into the medicine, and later on when I seen that the immediate outcome that surgery can provide, immediate result that surgery provides in the people, it is very gratifying for me. And I was normally gravitated to surgery, and then if I think in the hindsight, why surgery? I think that every time I go into surgery, I don't know something, I learn. So it was a very convergent thinking that I really appreciated it. I know I need to refine this question, but this is what came in top of my head.
Yeah, that's a good question. Like, yeah, you just need a little bit refinement. Otherwise, it's a good answer. So, anybody wants to answer any specialty you're going into, be it psychiatry or any other specialty? Or I should
guess
answer that question.
for internal medicine, we could say that internal medicine covers a wide range of medical conditions, and it's not limited to just one part of the body. And because it involves problem solving, that's why it's a more of an intellectual challenge, and that kind of draws us to it. And then there is an opportunity for you to develop a long-term relationship with your patient, and also it has a lot of career opportunities in the future. So I think that would be the reason that I would choose internal medicine.
Okay. That's a good, like, even I have one point that we can develop the long-term relationship with the patient. That's like one of the very valid points why internal medicine.
Yeah.
So yeah, that's a good point. Like, you just need to little bit draft it more. Otherwise, it's a good answer. Okay, perfect. So, Robin, do you want to say why pediatrics? Just frame your answer. No answer is wrong. No answer is wrong. Every answer is unique, and you can just go ahead with that, Robin. Like, why pediatrics? Or okay, I just say like what I have prepared for my answer is that, you know, growing up, like, I thought that a single doctor can do everything from surgery to, you know, childbirth to looking children, and, you know, even the looking after the patients in the hospital. But as I grew up and I did, you know, the clerkships during my third and the fourth year of medical school, I started liking medicine, interacting with the patients, taking care of them. And after the internship, I, you know, loved working in medicine. And you know, and the other important point is I like, you know, developing long-term relationships with the patients. So that is why internal medicine for me. Yeah, that's
This
not a
is
very
a
good
very good
answer.
answer.
I'm sorry.
Yeah, agree. No, I agree. It's a very good answer.
Very good answer.
Yeah.
No, it's not like it was impromptu. Like, that's what I have in my mind, but I just need 2 to 3 solid points by internal medicine. Anybody else wants to answer this question? Why internal medicine? Like, you might come up with better answers.
I guess we can include that it has opportunities for research as well, because I mean, internists engage in clinical research and develop new treatments. We could add that to our answer.
Yeah, but yeah, every branch has some kind of component of research.
Yeah, yeah, that's true.
But yeah, like, even I have one point that we can treat a large number of patients with the different complexities. We can take to the hospital. Then yeah, long-term relationships is a very important point. Is like, that's why everybody's into internal medicine. Yeah. That's, I have only just these 2 points. Yeah. Anybody wants to answer something? Like, you might come up with the better answers.
Yeah, I could say one point. I guess there is something gratifying about coming to a conclusion as far as patient diagnosis goes. So you have a case and you are trying to treat that case, you're trying to diagnose it, and that at the end, the whole process, the fruitfulness of it is what is, I think, gratifying, that you can come to a certain conclusion about it. you know, like
Mhm.
there's something, definitely there's some, yeah, that's the word I would use, gratification.
Yash,
Mhm.
can you please repeat your point again? That's a good point. Like, just can you repeat it once more?
Yeah, sure. So it's like
Yeah,
you
cool.
have a patient. You asked me, right, to repeat it?
Yeah.
Yeah.
Yeah,
So
the point you were talking about, yes.
yeah, so you have a patient and the patient has come to you. Now you don't know what the diagnosis is, so you try diagnosing the patient, and you do different tests, and you try to come to a certain conclusion about it. So that whole process of, like, in a way, you are if you want to do it, you can kind of like use a metaphor for it, that, you know, like from childhood, I always looked at used to watch detective shows, and you can kind of convert it into a metaphorical situation. I'm not saying use this exactly, but
Mhm.
like there is some kind of gratification attached to finally coming to a conclusion, finally coming to a diagnosis after having gone through like painstaking day in and day out, doing different procedures and tests on the patient, and then when you finally come to a diagnosis, there's something fruitful about it. You know, that inner gratification you get as a doctor. That's now, you know, you guys can like probably put down that as
Mhm.
points, but that is one point I think you might want to bring up,
చెప్పాలి
if that makes sense. Yeah.
Yeah,
ఎక్కడనా
that's very good
ఇంట్లో
point.
రా
Yeah. Satvik, you want to say
రండి
something?
కిందనే ఉంది చిల్లకన్నా ఉంది.
Just give me a second. I'll mute him. So basically, Yash told a very good point. The point is,
Mhm.
yeah, that's like we have a new patient with us. We get a chance to do all the tests, do the physical examination, come to a diagnosis. Even then, we can make the the required referrals as well, right? So kind of good point. Yeah. So like two solid points, like one is a long-term relationship, as Juveria said, and the other one, like Yash mentioned. I don't have any solid point because I haven't prepared for the answer yet.
Mhm.
Guys, am I audible? Like it's showing over here, my network is weak because it's unstable outside.
You're
Okay,
audible. Yeah.
perfect. Yeah. So, or do you want to discuss anything? Yeah, Sabia, you want to say something?
I'm saying your audio is a little lower, like it's a little difficult to hear you.
Oh, I'm sorry about that. Like, it's a thunderstorm going on outside. That's why
That's okay.
I couldn't connect. Earlier, I was, but now, like, at least I can join. But internet is unstable. So, yeah, you want to add something to the answer? Any point you have in your mind?
I actually just joined, so I'm like a little lost at the moment, trying to follow with you guys right now.
So we have the question, why a particular specialty? Like most of here are people over here are into medicine, but even if you're into pediatrics, psych or surgery, why that particular specialty? The question is that. So do you have any like strong points? Like do you have anything to add to that,
For
or you
me,
will
I
change
do
your answer?
pediatrics. For me, I want to do pediatrics. So one point
Yeah.
that I really like
Okay.
to bring up is that the effect that you can have on a child's personality. So you can bring up some childhood problem that you've had, and how having someone who can listen to you and give you that support when you're most vulnerable. Generally, children who come into hospital are very vulnerable. So being able to help them during that really shapes their personality and makes them feel better in the long run. And also the variety of cases that you see in pediatrics from like all the age groups are definitely not something you see in medicine. So yeah, being a backbone of medicine of pediatrics, being a backbone in medicine is really important. So yeah, I guess that's one of the points that I have.
That's a very good point. Yeah, for the pediatric, it's a very good point. Yeah. So Pravin, do you have any point to add? You can just come up with a point. That's fine. Like the point you mentioned in the chat.
Hello, guys. Can I also give my opinion about why internal medicine?
Go ahead, please. Sure.
Okay. First point is internal medicine creates an opportunity for physicians to have diverse group of patients with different diseases. It makes my practice really interesting. So I'll not have a boring practice, and I can see every day different group of patients with various diseases, and this keeps my practice interesting. and it makes me to study more, learn more about diseases that I have never seen or read about. And another important point is it creates more opportunity for me to study, to continue my study in fellowship programs. For example, I'm really interested in interventional cardiology, so this creates me an opportunity to continue my education. And besides cardiology, after studying internal medicine, we can study other areas like gastroenterology or infectious disease. So it has more opportunities for a person to continue their education after graduation of internal medicine program. And this, I think, is really useful for people who like to make new challenges in their lives. So these points, I think, are really important for a person who wants to make something new in their life and who wants to make their practice interesting, and learn a lot of things during their practice.
That's a
That's
very
it.
good chance to explore different specialties. That's a very good point. Perfect. So yeah, Anwar, like anybody wants to just talk about this answer? Like, do you want to add your points or something? Anybody? Yeah, so Anwar, previously we had the same point and we just discussed that we shouldn't be talking about the fellowship thing. Like we shouldn't be talking about, very competitive fellowships like intervention cardiology or gastroenterology or maybe hemato-onc right now, because the program might not have these specialties. So yeah, but it's a good point that we get a chance to explore and we can do the fellowships in different branches that in different subspecialties after internal medicine residency. That's even a very strong point. Yeah.
Well, what about, for example,
Yeah.
in surgery, for example, or in other specialties, they have like they can treat or they can help patients like 5 to 10 a day, for example, maximum. But in internal medicine, we can treat patients like diverse group of patients like 20, 30, or even more. I mean, we have a lot of patients because we cover most of the specialties like endocrinology, gastroenterology, and internal medicine. So it gives us an opportunity to explore more patients, more diseases. So it's really interesting in this case, I mean.
Yeah, that's a very, you absolutely right to say a large number of patients, because we are the primary contact in US. Like we see the patients first and then make the required referral. Even nobody will directly come to the surgeon. They'll first come to a emergency that might be run by a primary care physician. After that, we can make the required referrals. So we are the primary contact of the patients in the US. Yeah, that's a very good point as well. You get to see a large number of patients. So yeah, thank you, Anwar. You want to add anything else, or somebody else wants to add something to the answer? Or do you want us to discuss any previous question you had? Yeah, sorry, go ahead. Or do you want to discuss any previous question you have, any other question you have? Like we can go ahead with that as well. We have covered the maximum number. Go ahead, please.
Okay. So I would like to ask about what are the weaknesses, and I've been thinking more about this question, and I couldn't figure out which would be the best option for me. And I've read and seen a lot of videos and and noticed that if a person doesn't have enough U.S. clinical experience, they can tell about that they have not enough U.S. clinical experience, and that might be their weakness, but they have a personality trait like adaptability, which makes them to adapt to an environment, place, and healthcare system very quickly. And like at the same time you show weakness, and at the same time you tell that you are adaptable and you can cope with any problems, any new challenges in U.S. healthcare system. And this weakness, I mean, could we say like U.S. clinic experience is my weakness, like to deliver it more accurately or properly?
But Anwar, why like that's not a weakness firstly, and why do you want to bring up during the interview that you don't have the sufficient USCE, right? You just have,
because
in my USCE I can work, I can adapt to the system. That's not a personality trait, and that's not a good point to bring up during the interviews, right? You have many other good things in your CV, right?
Okay.
So like, why do you want to talk when they talk to you? Why don't you have the sufficient USCE? Then you can discuss about that, right? That's kind of like little bit of a red flag. But red flag is something that we don't want to show them that it's a red flag. Once they talk about it, we can discuss, right?
Okay.
We have discussed in the previous meetings from this, like we can just go on the personality trait, like the few weaknesses we have, like somebody, like in the previous sessions we had on this question, somebody told that they procrastinate a lot when there is a lot of stress. So what they do is, how they are improving on that is they just break their larger task into a smaller one, and it helps them a lot, right? Like I told that I try to please everybody and try to win their good books, but that affects my efficiency at the end of the day, and it affects my mental health. So I am working on that as well. Right?
Great.
Then like any other weakness you can have, like I just have noted down my copy. I should bring it down, like what points everybody talked about. Just give me a second.
Okay. Thank you. Wow.
So Anwar, you can have a personality trait that you want to talk about right now. Any personality trait that you feel that that's your weakness.
Okay. So I don't know, like why many people use public speaking.
Yeah, go ahead, Anwar. Sorry.
Okay, I've seen many people saying like public speaking is like my weakness. When I go to the scene in front of many people, I feel anxious, and I sometimes forget my words. I saw such things like weakness as public speaking or overly sensitive. But I think it's like I think many people use this, and there should be some weakness that would really be personal for the person. And I don't know why can it be said. I have some personality trait. I think it's like some fear. I don't know, can we say that? I fear dogs. When I see them, I feel anxious, and I fear that they can bite me. So, and I connected this to medicine. For example, when I see my patients having a dogs, I ask them to let their dog, leave their dog out of the room, so I can concentrate more on the patient, and I can make full physical examination, history and physical examination, so I can concentrate more on the patient rather than a dog. So this when patient with a dog comes to my room, for example, visit, I feel nervous and I feel some discomfort. So can we say so? I mean, like having some discomfort when you say a dog with a patient.
I think what they're asking the interviewer specifically, they want some behavioral issue that you might have, like a personality, and they want to see how you overcame it. So yeah, dogs is there, but then if you talk about something that's more like related to medicine, it would be better. Like, oh, I like pleasing people, like I'm over pleaser, or like, I need like, support, or I'm very meticulous, or like I'm a perfectionist, those kind of things. And then you relate it how it's good, and then how you're trying to improve it as well. I think that'd be a better option than the dog. The dog makes sense. I'm scared of dogs too. But then I don't think it would be related to medicine as of yet.
So, and I also read one option of weakness, like being I'm comparatively slow workers than other people. But when I do so, I make sure that I work effectively and in detail.
That's a good one. That's a good one.
Yeah, I make sure that the quality is better by sacrificing time. But I'm doing my best to work faster and
But I'd
something
say
like that.
phrase it the opposite way. Say that, instead of saying I'm slow, say that I'm very detailed. I like going into
I'm
think he's
sorry,
back.
my internet, yeah.
I think he's back.
Go ahead. I'm so sorry about that. My internet is not working. Yeah.
No, Anwar was just
work
talking
on
about a
that.
weekend.
Just give me a second.
No, Anwar was
You've come.
Yeah. Go ahead.
No, don't wait for me. Go. We'll go again in the evening. अभी तो मेरे को time लगेगा बेटा. बहुत सारा काम कर रहा हूँ अभी.
I just, but yeah. So I think I'm back. Yeah. I don't know. The internet sucks.
recording in.
Yeah, I'm back. Sorry. Yeah, I'm gonna just go ahead. Anwar, please go ahead with your weakness.
Yeah, I was giving some options and fear of dogs when I see a patient with a dog, and another option was I work comparatively slow, to other people, but I make sure that I do all the work in detail and effectively with high quality, something like that. Yeah. And someone was giving me feedback, and at that time we had some interruption, and that's why.
Yeah, I was just saying that instead of saying that you're a slow speaker or a slow worker, start with saying that you're a perfectionist and you like doing things in detail, which makes you slow, which you're working on, so it doesn't come off as very negative. Yeah. That's what I was trying to say.
That's a very good point. Yes, that's a good point, Anwar. Yeah. So I just want to say I just have a point to mention about the last meeting we had. So one of the weaknesses, I think one of the persons said that their weakness is public speaking, or when they interact with the people in the authority, he used to feel anxious at that point of time. But yeah, as he moved, he started interacting with more and more people, more of his senior doctors, and that's how he was able to overcome that fear up to a certain extent. That was even a weakness somebody talked about in the previous meeting. Yeah.
That's great. And I also read about one weakness, I heard. So the person said that I have a big family and I have parents and 4 brothers. So I was raised in a big family, so I don't like working alone, or when I'm working alone, I feel anxious and demotivated. So when I'm in a group of people, when I'm in a team, I feel more motivated, and I feel the strength and energy to keep up on my work and cope with difficulties. So I'm a team player, you can say. Weakness is being alone. Working alone is a weakness, and when I'm in a group of people, I work better. So this option, I heard about this option, and I think that this might be a good option to tell about. Yeah. A weakness, working alone is a weakness. Especially in internal medicine, it would be really weakness.
So you can just talk about whatever weakness you have, you just have to add an end line with how you're working with that, right? Because one in this earth is perfect. Everybody has one or the other kind of weakness, right? So yeah.
Yes.
So even I mentioned about my public speaking, that I was very anxious and I was not able to speak publicly. So then I came up with my Instagram page where I connect to about 1,700 people. To take their mentorship sessions, I used to take webinars. Then that's how, my public speaking, that improved a bit, right? Plus, I have then I started, I can even talk about, we used to have daily interview preparation sessions on a Zoom call with about 50 to 100 people every day. And that's how we were able to improve our communication skills better, right? I think everybody who attends can just talk about, even somebody doesn't attend, they can even mention Like that's how we improved our public speaking skills and our communication skills.
Yeah, that's great.
Yeah, I think I have one as well. You could put it in a way that one of my areas of weakness is time management. And then you have to follow, as you obviously know, you have to follow it with how did you deal with it? So, like you just said, Instagram page for public speaking. For time management, you could say it was a weakness for a very long time. But after I learned and trained under a lot of my mentors and professors and etc. I think I overcome, like we all have had this, right? Like we have so many patients to manage, and then time management definitely becomes an issue wherein you have to review their charts and then go through their orders and then also treat them. That all comes under whether you're able to manage time well or not. And slowly over time, you could tell them that I developed ways where I could manage time in a better way. So now I feel much more confident about it.
Even like we can just come up, like I had a checklist. I started working on a checklist every day for maybe a month. Then after that things improved and I was able to manage things very well. That's a very good point, Yash. Yeah, thank you. Vivek, you want to add something to this? Please go ahead. Turn on your audio.
Can we say that I find it difficult to ask other people for help when
Can you be a little loud, Vivek? Can you be a little loud?
Hello?
Yeah. Now it's better.
Yeah, can we say like that? I find it difficult to ask other people for help when needed. Like I have this idea, but I don't think like in every emergency cases we ask for help. Like we are uh, we are taught to like call for help. Is it appropriate to say like this, or do you have any better way to say this kind of weakness?
Anybody wants to add something to this? Like that's a weakness, but yeah, we need a better
I
word.
think there's unable to delegate your task. Like I'm unable to delegate my task to other people. I like perfecting it myself. So I think that would be a better way to say it than saying I don't like asking for help. So yeah.
So you have any weakness to add? We just need weaknesses right now, so we can have this.
I think one thing that I've written down about myself is the need for validation. That I need validation from my seniors to work better, and I feel like I take criticism like a lot. Like I have to work on it, and I think I like to base it again off where it roots and how journaling or something like that helped me overcome it. And like I think if you can talk a bit about like imposter syndrome, but I'm not sure if you should, but then imposter syndrome with your validation and all of that. If you can make a little thing about that, I think that's what I'm going to discuss.
That's a good point. Yeah. And yeah, the way you're working on that by journaling and stuff, it's a good point.
Also, there's like self-critic. You can say that as well.
Okay.
I'm a really big self-critic. So yeah.
But that's your strength, right?
Is it though?
Yeah, it's like that's a very good. Like only few people can be self-critic, right? Like they can just criticize themselves and improve on that. So that would be like I would consider your strength for me.
I actually consider it as a weakness, so that's funny. Like I go like my self-criticism is a really big thing that I hate. Like it's a weakness that I'm such a big critic of myself that I find it hard to, the same way you say perfectionism can be a weakness, I think the same way.
Yeah.
So if you can put that into here, that would sound great as people consider it as a strength.
No, that's your interview, right? That are your answers. It's an art to put out your answers, and it's up to you. Like you want to put it as a strength or a weakness.
Yeah.
Right? You can justify that, then that's good. Like yeah, Dr. Om, please go ahead.
Yeah. One of the weaknesses that I was thinking like I was gonna mention is that like I've had this like long-standing fear of like approaching authority figures, as in like like in a hospital, like the attending physician or like the professor or like the head of the department with maybe like a doubt or like asking them to like what do I need to do next or something like that, because like this fear of them like looking like seeing me in a negative way, or maybe they're gonna yell at me for something, so that constant fear. So that was something that like I feel like, I want to bring up. I was thinking like, what would be a better, because I think like any weakness has to be paired with like what you're doing to improve yourself,
Yeah.
to fix it, to correct it. So I was thinking like what would be a good way to say that I'm like dealing with it, other than just saying like I'm just putting myself in that situation more often so that I like learn to handle it. So I mean, like, so what do you guys think? Like, do you think that could work? Do you guys have any like inputs on that?
That's a good weakness to talk about. Yeah, but we just need to add something to how you're working on that. So you can probably say that I'm underconfident. I feel sometimes underconfident when I talk to my senior figures, and I'm working on that. I recognize my weakness, and I'm trying to interact with more and more people. That's what I have in my mind. Anybody else wants to add something with a better words and better draft or?
I think one way you could say it, and like, that try not to make it sound like you're too underconfident. Like, just say that, I guess, like, people I have immense respect for, I find difficulty going up to them. Like, instead of making them look very negative, like, I think I would say something along those lines. And like, because straight up saying underconfident I don't think that would be a very good light to put yourself into.
Or like like what about intimidated? Somebody who says that I feel intimidated when I talk to my senior figures, or
Yeah, that's better than saying you're confident.
Okay,
Yeah,
so
I think like,
actually,
yeah, Grace, please go ahead, Dr. Grace. Yeah.
yeah, actually, I agree. I don't think you should put it that way because whatever weakness you have, you don't want it to be something that's going to affect your work. That's how you want to look at it. So when you put it in that way, to me, it seems as if you won't be able to approach your senior colleagues, you won't be able to approach your attendants. And I mean that's what an intern is going to do as a PGY1. You want to be someone that can communicate, that if you have any doubt, you'll be able to reach the next person without any fear of reproach. You need to be able to clarify stuff. So when you put it that way, it kind of sets doubt. So what I've learned about weakness is your weakness should be something that definitely are working on, but something that does not directly affect your skills in such a way. So I don't know. I'm not really comfortable with this weakness. That's just my opinion.
If I could go again, I think one way you could put it is like, as a medical student, I had this perceived idea that my seniors are unapproachable. But as I did my internship or did my house job, if you guys did your house jobs, I learned that they themselves are humans as well and very approachable. And I think the amount of time I've worked with them, I've realized that seniors are just humans and some of them are more than happy to help. So this is a weakness, and you tell them how you overcame it as well. So I think that would be a better way to approach that.
That's
yeah,
cool.
I think like, thank you so much like for the advice. I think like, I'll keep it in mind and I'll like rephrase the answer in my head, like to like put in your point rather than, to focus more on like how I'm improving that. Thank you.
So are we done with this question? Like we're done with why internal medicine, and anybody wants to add something to that, or any other specialty they want to be part of? That's fine. Like you can just go ahead with your answers. Or like the next question was your weakness. So we talked about the few weaknesses. Like I for me it's over generous or a people pleaser. I've definitely come up with a better word. Then as time management can be another weakness, public speaking can be another weakness. Then like for me, procrastination at times when I'm under stress can be a weakness for me. Yeah. Like, Dr. Om said, like, dealing with the seniority figures can be a weakness, but yeah, you have to put it in the right way and how you're improving on that. Therefore, anybody want to add any other weakness you have? Or somebody just said like fear of dogs. That even you can talk about. That's your weakness at the like you feel and how you're being able to overcome that. That's
Sorry, I just want to note, like, something I thought about, like, when the person who brought up their fear of dogs. I just wanted to note, like, please, like, emphasize more on that you're like working on it, because as if I'm not mistaken, in the US, if you have a service dog, they are legally it is against the law for you to like tell them to leave their dog out. So if it's like an actual like phobia that you have of dogs, please mention, like, I would rather not bring it up, but if you are, like, say that like you're working, because like I think the person they mentioned that like they would say ask the patient to leave the dog out. In the US, if it's a service animal, you cannot ask them to do that, if I'm not mistaken. So, like, again, like, have that in mind for the person like who said the fear of dogs. Please think about that.
Plus, in US, you don't have any street dogs, so you don't need to get worried about that. We have that in our country,
Yeah,
not in US.
yeah. The street dogs are not an issue. The thing is about service animals. Like, if a patient brings in like a service animal, like a seeing eye dog, like they cannot, like, if the person has the fear of dogs, they cannot ask the patient to like leave the dog out.
Yeah.
So yeah, that was something that was on my mind. But yeah, other than that, like, yeah, I think like you can like phrase it in a way that you're working on it, and like it could be a really good answer.
So, like Prabhin asked a good question, that how to deal with a patient who lost faith or trust with the healthcare. That's a good question, right?
I mean, if I can give venture an answer, like I would say like the first step is to start like a personal connection, because like if they have this thing, show them that okay, at least like you are there to like listen to them, because you are their point of contact right now. So you make an extra effort to like listen to them, and like while like dealing with them, try to understand why. Like there'll be specific issues or like maybe specific instances. It could be anything, like maybe they were like, if they're like someone of like a different race, maybe they were treated like, discriminated against, or like someone, like if they were a woman, maybe they were like inappropriately like handled. Like it could be any n number of reasons, right? So figure that out and like address that specifically. I think that would be the first step to like getting the patient more comfortable with you to talk to you, and then like anything else can be addressed moving forward.
Yeah, that's a good point. Yes, like we can just start with an open question and just address that, and then maybe like few follow-up visits we can have and try to build a patient-doctor relationship with them, and that might improve the situation. Yeah, that's how we can just deal with somebody who just lost or trust with the healthcare. Anybody else wants to add something? There's just 47 people right now. Definitely, there are many people who have very good credentials, but definitely better than me. So you can, and you must be having a better prep. You can definitely come up with some points or something, like whatever you have in your mind. Just show your supremacy here.
I think I would go with saying like the root cause of loss of trust, why it happened and where it happened. Like I think establish like a good rapport with the patient, from a like a friend point of view. Like I don't know if you should say friend, but then as a personal point of view, if you could help them open up a little bit more and then see why they're feeling that way, and then slowly but surely like edge them towards like gain their trust back basically.
And like another important thing is to also just avoid, like, because they're coming to you and they're probably going to have complaints, obviously. So one of the things that we want to avoid is saying anything like, oh, we're not going to be like them or something like that. You just want to talk about your skills of like, I'm sorry that you had to go through that. Let's see what we can do. And I'm glad that you came into the office. That's the first big step of coming back after losing your trust. So thank you for doing that. Like, be as polite as possible. And that helps to like open the door for them to communicate, because it puts them a little bit less on the defensive, and it's more like you're acknowledging their pain, and that's important to them.
Yeah, that's a good thing. Like a non-judgmental approach. Like that's a typical ethics question you can get. So you will start with an open-ended conversation and have a judgmental approach. Yeah, that's a good point. Thank you so much, Dr. Silva. Yeah. So we have Dr. Puri with us. Do you want to speak something? Dr. Gyanandra Puri. Or okay. So are we done with the 3 questions? Like, like that's even a good question, how to deal with a difficult patient. And then we can just talk about like, we talked about the weaknesses. That's a previous question, but that's good that we talked about a few more weaknesses that we can talk about. Then we talked about why internal medicine. Anybody else has any other question to add, or they want to just answer any previous question you have? Even if you want to talk about how to deal.
For me,
Yeah, go ahead, Sabia, please. Thank
I
you.
think tell me about yourself. I'm still a little like shaky on how I'm supposed to phrase it and how I'm starting and how I'm ending and all of that.
Okay. So you want to answer that right now? Like everybody can give their input.
Yeah, I think so. So I had written down a little bit just to give myself. So number one, I'm like a little. People say you shouldn't start with giving your name out. Like, are you supposed to do that, or do you say I'm Sabiha? Do you not? Like,
Yeah, I feel when you start a conversation with anybody, why to assume that he knows everything about you, right? He has a seat in hand, but you're not that important to that person, right? And
yeah.
when you start a conversation, especially an interview, and it's such a big day for you, right? So it's always
Yeah.
good to start with a name.
Okay.
Okay. Any pets in the house?
Yeah.
Religion in particular?
You want to talk about that, Sabia? Like you want to start with telling me about
Yeah.
yourself?
So what I was planning to do was
Any
think,
other
okay, I'm
relatives
Sabiha. I recently graduated from Dubai Medical College. I'm originally Pakistani. I was born in the US, and then I was raised in a small little city like around an hour drive off Dubai called Elaine. And this city itself wasn't very culturally diverse. So as a child, I did have to face a bit of racism, being an ethnic minority there. But I quickly learned as a child that like the root cause of racism is being misunderstood. And through that, I developed communication skills. I became really good at public speaking. And one main prog that came out of all of this was I learned a new language. I learned how to speak Arabic quite fluently. This later on helped me when I joined the hospitals. I then started my university in Dubai, where I excelled both academically, extracurricularly, and I did a few research projects there as well. And I was always on top of my class, quite a big part of a lot of the clubs that were present in my university, and always a main person at all our elective project presentations, symposiums. Other than that, I developed a few, not developed, hold on. I also took up a few hobbies. I can say that I took a few hobbies up, which I think made me a well-rounded applicant. And then we joined the hospitals in Dubai hospitals. So Dubai Health Authority has quite a few hospitals which come under it. And I managed to see like a wide variety of cases throughout my time there. Being a very big government hospitals, I learned how to work well under pressure. I also saw a wide range of cases and learned how to work with Epic, the EMR that was used in Dubai. I also learned while working in DHA, I fell in love with pediatrics and decided to pursue it as my specialty of interest. I think that's about where I end, but I don't know how to go on from here and like finish it.
Perfect answer. Like for me, it is a very good answer. Yeah, you just need to little bit work on more on that, maybe drafting. Otherwise, it's a good answer. You cover your hobbies, you cover your name, your medical skills. Yeah, Grace, please go ahead. Sorry.
Okay, it was very good. As in, I was really impressed. I could follow through from the beginning, your story, and how you got to medical school in Dubai. It was really good. And the context wise was really great. But towards the end, I guess because maybe you've not yet practiced, kept on saying I don't know, like if you can use other words, like I
Yeah.
learned, yes. But I guess because you've not put it together, because the initial statements were very thoughtful and they were flowing quite well. But I felt it was good. And towards the end, you were also saying a lot of they say when you do that, it's like you're trying to recollect and it breaks your conversation. So maybe if you don't really know what to say at that point, I just maybe take a break and like just pause then. But you can say it once or twice, but saying it repeatedly just then to end it, you may just end, oh, I'm really glad to be here with you today, interviewing at your program, or just end it with something nice. Well done.
Yeah, mate, thank you so much. No, that makes sense. I think I've practiced the beginning part of this whole thing quite a few times, but the ending I haven't. So I think I need to say it a few times to myself in the mirror or something to make it better. Thank you.
yeah, we can just like one more thing, like I heard during the webinars is that how to, everybody starts a question, but it's good to learn how to close the question as well. Like somebody asks you about, tell me about yourself, you can just end with like, that's me. Or you ask somebody asks your strengths, that's I feel are my strengths, but that I feel are my weaknesses or something like that. Just don't abruptly end the answer, right? It doesn't look like that's what they say in class, right? That's
Yeah,
not
so
my experience. So
and
I
there's
think
also something I wanted to say. I don't know, because I didn't time. You shouldn't go more than 90 seconds. I guess that's what everyone is going with. So you can just time yourself when you're practicing. Usually say between 60 to 90 seconds. That's like what everyone has to say.
All right, yeah, that sounds like a plan.
somebody just asked a question. Could you please discuss the question, why and how do you deal with it? Okay, Yashita. So yeah, first Dr. Yadav asked about how to deal with, do you remember any mistake you have done during your duty? Like, that's a typical ethics question we have. So anybody wants to answer about that? First, we'll go with that. Like, how do you remember if you committed any mistake and how you dealt with that during your duty? Dr. Yadav, do you have anything in your mind? Please go ahead. You can just answer something like, if you remember anything, any incident like that, you can just, talk about it over here. Or anybody else wants to talk about that? Like, I would say I just went, like, that's what a typical ethics question is, that you have to go and, talk to the patient and tell him that I did this mistake or something. But yeah. Even if like during my practice, when I had committed a mistake, then definitely I try to cover it up. Even my seniors try to cover it up. But yeah, that's what I can say during my interview. Something anybody has to talk about that?
So we're answering conflicts, right?
Go ahead, Grace.
Okay, so I guess for something like this conflict with your colleagues, you use the STAR approach, the situation, the task, your approach, and your results. So let me just give an example. So you can say, okay, during medical school, I was assigned a project to work with 3 people. And while doing the research and the project, we couldn't agree on the methodology. One of us couldn't agree on the methodology, and it was really causing delay to our project work. So I approached the individual in a non-confrontational manner to try to get an insight of why she wanted to use a different approach than what we were taught. And I was able to gain insight into why she thought so, because the first approach we were going to use, she felt it was going to be burdensome to us. So that's the reason why she didn't agree with the approach. And while doing this, we're able to agree on the way to go forward. And this has actually, and we're able to finish the project on time and as a group. So this has taught me about communication, the importance of approaching people and understanding their perspectives about things and everything we do. So something like that, yeah. Oh, I'm done.
Could answer in a more of a lighter note. I think like one of the mistakes, like I'm trying to remember some of my mistakes, and all I can remember is once I called someone, I had to give a referral, and I called the wrong consultant by accident, and I got screamed at on the phone. And I think that was for me, that was a really big mistake at that point, because it was one of the few consults that I already made. Like it was at the very beginning of my you can say intern year. So that really shook me. And then I was a little scared to make consults after that. But then after talking to my senior, and then they like reassured me that this is normal, and then making mistakes is very normal in the beginning of your career. I just double checked everything before I did it. And I never ended up making that mistake again. So I think something like that would also be okay.
Yeah.
I want to catch a big fish.
And Dr. Sudharan, do you want to talk about this question? Or can talk about it during my medical school, during my 3rd year, during my casualty posting in a surgery emergency, I was given an IM injection. So I just missed to apply alcohol. I just missed to, clean that area before. So like I can just talk about that, like how my seniors taught me the right way, and they told me the importance of that. It can lead to some very like it can lead to infection in that local area, or even can lead to a blood infection. So I have to be careful from next time. That's how I work on that in the future. And I always made it a point to clean that part first and then go for an injection. Like that's what I even had in my mind. Like that, I think that happened with everyone. Like, can anybody frame that for me in a better way? Or if do you have any other incidents to talk about? Because I'm sure everybody has some incidents to talk about, but yeah, it doesn't click our mind at that point of time. So
I I'm sorry. I think like your example is like pretty good because I think it's again it's a common mistake that I think everyone makes, and I think it's a good like this thing to say like how you started learning about like the importance of protocols. The stepwise like when it comes to like surgical like hands-on this things from like administering injections to like suturing or whatever like to follow a stepwise rule. I think like that's a good way to like phrase it and like a good way to say what you learned from it, learn from that mistake.
okay, thanks. Like yeah, even I can talk about that's how I learned about the protocols and the importance of protocols, why they are made in the first place, right? Because
Yeah.
everything comes up with a complication, and to avoid that, we do have these protocols in place. Yeah, that's a good point. Thank you
Exactly.
so much. Yeah, any other
Yeah, no problem.
point you have to discuss about, please go ahead. Or like even you had sometimes a quarrel with your colleague, how you dealt with that? That's even a very important question. Like I don't know like how would I deal with that, because I would probably maintain a distance from that person. But that's not like how I can tell that how I deal with such situation, because in for me I'll take the onus on me and I'll do the task myself. I would instead of getting in trouble with that person, I would do things on my own, and I just feel that's my weakness as well. But yeah, I cannot talk about that. So anybody has a good point, like how or any experience how you dealt with your difficult colleague, or you even yeah.
Sorry. For this, like, if I was asked this question again, like, I think like every question, like, they're trying to figure out something, right? Like leadership, communication. I think this would come under like how much, how well, how good you are at communicating. So I think like you could answer something like first, I would try to talk to the person, try to understand what exactly their issue is. Why are we having this like if it's a fight, like why are we having this fight in the first place? What happened? What do they think happened? Like, is it a misunderstanding on their part? Is it a misunderstanding on my part? Like that, communicating with them. And then after a certain point, if it feels like it's not going to get resolved, then to this thing and to like escalate it to like a higher, like, to higher authority, like to our supervisor, whoever they are, like, and then escalate it to them so that like it can be resolved like amicably. But first try to understand where that person is coming from. I think that should be like the core idea of like what that the answer to that question should be.
Yeah, definitely. Like, yeah, I can just say that I will directly, first try to understand that situation and try to figure out how, how like things are happening. Then I'll try to confront directly with my colleague and have a direct word from with him. And if after that even things are not resolved, I can just get in touch with my seniors and try to get a solution to the situation. Yeah, that would be great for me. Like I have to just draft it in the right way, because I had pretty good experiences like in India when I worked in two hospitals. So I every time got difficult colleagues, but yeah, I didn't handle them this way, because everybody like it's difficult to handle such people. Yeah. But yeah, that's a good point. Like I can talk about. Anybody else has any other good experience or anything to talk about, or you have any other past question you want to answer? Please go ahead. It's a free meeting.
I think if you can add in a story, I'm like big on storytelling. So if you have your own experience that you had and like alter it to a way obviously which it makes you look good, but then definitely if you can tell them a little bit of a story about what happened, I think that would be a good way of bringing in how you deal with conflicts as well. So yeah, my main thing, I think what I've written down so far is like I had like get to the root of the conflict, always be open to criticism, and then see how the other person was affected, and then speak in or bring the senior if needed after speaking. Just like I think Om had said before this as well. But then I'm planning to like bring in a story of my own if I can. So yeah, that's about it.
Even I was watching the interview of Malke Saad with the girl, like it's in I think 1.5 hour interview, and he asked her about that question. So she just came up with a answer that once she was in emergency and there was some miscommunication between the senior and her, and later on the senior little bit scolded her, and then after that she just had she just had a word with that senior and tried to understand the situation, and that's how she improved over that next time. Like that's what she answered. But yeah.
Yeah, I've seen that. Yeah.
Okay. Any other question you want to answer? Because I think it's 11 already. So we are 1 to 1 hour, 15 minutes into the meeting. If you want to end or want to discuss something, I'm so sorry that I just joined the class late and it started late. I'm sorry about that, but yeah, the internet at my place is very weak. So
That's fine. Like, I mean, just joining late. I mean, like you still joined, so that's good. So there was this one question that was like brought up in a previous meeting. The something like, what animal do you relate to? And I just wanted to know in that discussion, like, what was the general theme? Like, in the sense, like, what did you guys think that like the interview is trying to get out of you in that question?
Okay.
Like with that question, do you guys like remember that? For anyone who attended that meeting as well.
So, okay. So basically that was a question that I made because one day there's another group like mock interview group something. So there was some expert in that and she mentioned about this question. Like she told that they can come up with any question like this, right? The basic questions like tell me about yourself, why internal medicine or why a particular specialty, why you wanted to be a doctor. These questions, everybody prepares them very well. Right, but sometimes they come up with a very weird questions like tell me like how can you relate to a particular color, how can you relate to a particular car, how can you relate to a particular animal, right? So like we should even have those things in our mind that why a particular animal or a particular color. So at least we should have something. That's why I just came up with this question because to be very honest, we're doing the meeting since first, right? So we actually have covered a lot of questions here. Actually, we're not left with any questions. So that was an interesting question that I came up with. Like I thought that we can discuss about that, right? Somebody can give their viewpoints. Even I had an animal in my mind I can talk about, right? So yeah, so that's why I talked about that.
I think it's also a way to judge your strengths. Like the way you ask someone, what are your strengths? What are your weaknesses? It's around the same, I think, asking what kind of animal you'd be, because this is a point where you can tell what your strengths are and what your weaknesses are. So I think it's around the same psyche behind it.
They basically want to get an insight into our personality, that how we perceive ourselves, right? So they get an idea about that. Otherwise,
okay. I got it. That's what I was going for. Like, what are they trying to like gauge? Like, what are they trying to like find out about us through that question? So, yeah, I think like personality. I think that's this thing. I'll like think about it in that sense. Thank you.
So, any other questions we have? Yeah, this meeting is being recorded, and I'll share the link in the I'll share the link of the recorded session in the group. Yeah. Any other thing anybody wants to discuss? Tomorrow we'll be on time, and yeah. I think like more people wanted to join, but I just started it late. So yeah, any other thing you want to discuss? Yeah, please go ahead.
Hi, hi team. This is Saurav here. Like, sorry for putting up a question on the ending of the meeting.
Oh, no,
I know this question has. Thank you. I know this question has been discussed very repeatedly, but then like if somebody wants to give in his or her input on the very question, like why did you choose like a residency in USA rather than your home country? So how will you put it in your words?
Yeah, anybody wants to answer that question?
I think it's a little different for every country. Like I studied in the UAE, And for me, I'm definitely going to mention that even though UAE is very fast developing and a lot of new things are coming up, but there is definitely a lack of growth in the education and the specialization departments, even though it's starting up, but it's a bit slow. And obviously, I can say, like, I being a perfectionist, when I actually want to improve my skills to a point where I am the best I can be. So US was definitely an option that stood out for me, and that's why I'd like to go to the US. And if you have family there, I think you can mention that as well.
Okay, like that's a really good answer. Thank you for that. So I was reading on a Reddit, like when they ask us questions like that, like we should not berate our own country. So I was in the judgment that should I speak something about my country rather than like saying very generic thing, or just like talk about my skills and my future plans, and that's why I choose this country. So how do you think about that?
Yeah. So like you can just start every like this answer with like talking about my background. I've done these few months of USC across like how many places you did, or like maybe New York I did that, and over that I learned and liked about the US healthcare system is like for me it is a multidisciplinary and holistic approach that I like about the US healthcare system, that there's involvement of the doctors, nurses, then we have the social workers, pharmacists, and then after the patient is being discharged, they have nursing homes, old age homes, then even they get care at home, which I like something about US a lot. Then you can just talk about like I just like how the the incorporation of the age appropriate screening into the system. Like we have the you can even talk about that as well. Like I would talk about that I can like I like importance of the ethics in the importance of ethics in the US healthcare system. How the autonomy of the patient is I sorry how the autonomy of the patient is given a priority in this healthcare system. So I like that as well. Then I can just talk about I want to work in a state of art facility or with a world class infrastructure. Like that's what like people said in the previous meetings. Yeah, you can just add your points, or you can even correct my points as well.
Oh, that's awesome. Thank you so much, Ayushman, for this.
To be very honest, I don't know if these are the good answers or not. But yeah, when somebody asks, like that's what I have written the points when the question was, why the US healthcare system, right? So yeah, like and a few days back we had a question, why our residency program? Then we can just talk about their goals and how we resonate with them, right? And then we can even talk about if we have family in a particular area, then we can talk about their curriculum and everything, how we like it. Like they might focus more on the primary care or being a hospitalist, and we can just say that we are more interested in that as well. So yeah, you just have to, that depends on the program and everything. Yeah.
Yeah, a lot of like good points. A couple of points that like I would like to add is like one thing I liked about the US healthcare system is how systematic the approach to healthcare is within the hospital itself. Like there is a set protocol for you to like, call a consulting doctor, how to contact them, who's on call, like, stuff like that. It's like very, very organized. And like you can say that like, you like working in that organized environment like and like how the electronic medical record system like tracks a patient's health records, like how that system is like very well developed in the US. And therefore like again it like you feel comfortable, and like you feel like this is the place where you want to work, where everything is so organized and systematic, and it helps you do your job to the best of your capabilities. And another this thing is also like you can like mention how US is in a really good place when it comes to like balancing autonomy and like beneficence with regards to like how different religions, people from like different religions and cultures approach healthcare with like all of their these things. And like US is in a good place to both like give them the best possible care while still respecting their like cultures and customs, no matter like no matter what they are, like that. So these are 2 points I think like you can like mention this thing without like again like keeping in theme of like you are giving the positives of US healthcare without like necessarily like saying anything bad about uh India or Pakistan, or like wherever the person's coming from.
That's a very good point, Doctor. So even like what I feel like I like more about the US healthcare system is the care after discharge. Like people, if depending upon their choices, they can go to nursing home. If it's an old age, older patient, then they can go to old age homes. Then somebody wants a home-based care, they can get that. Then there's a hospice as well. So like I just feel there's more continuity of care after discharge in US, and that's what I like it more. That's why I like it more. Like that's what I have observed during my US clinical experience. But yeah. Like I would even talk about that as well.
Thank you for putting all these brilliant points. I think this really makes sense. Like without berating your own home country, you're giving a preference to your own skills and the advantages you want to acquire from this place. So yeah, thank you for sharing.
End the meeting. Like I think it's like 11:15, so we are here for 1.5. But if anybody has any other questions, please go ahead, right? Because we usually have it for 1.5 hours. So, or we can just meet tomorrow around 9. I will be there. I'll make sure I'll be there around 9, and I'll just make sure I have a good network as well. I'm sorry. So yeah, should we end the meeting and see everyone tomorrow? I think
Yeah, that sounds good. Thank you so much. It
Thank
really
you.
helped me.
Yeah.
Thank you so
Thank
much.
you.
Thank you.
Have a good
Thank
day
you.
ahead. Bye-bye.
Thank you.
Bye.